Nightingale's Nursing Principles, Hygiene, Care, and Compassion. Introduction. Florence Nightingale became world-famous during the Crimean War in the 1850s when she significantly contributed to the development of nursing. In 1859, she published her renowned book Notes on Nursing, What It Is and What It Is Not, which almost immediately became a classic in the relevant medical field. In her book, Nightingale reveals her beliefs and values, as well as their features and possibilities in practice. She is convinced that personal attention to the patient and the nurse's observance of hygiene are decisive factors in ensuring the patient's quality of care and support. Values and beliefs. As she highlighted in her book, one of Nightingale's essential values in nursing practice is the importance of hygiene in health facilities. According to her, providing clean conditions is crucial to the specialist's activities. She was also confident that a regularly ventilated and clean room would prevent disease transmission. The concept of cleanliness also includes regular hand washing and proper medical waste management, which will halt or slow the spread of infection among patients and healthcare workers. In addition to maintaining hygiene in the room, Nightingale considered the individual care of the nurse concerning the patient no less critical. In her view, every medical worker needing care requires personal care based on their needs. Individual care means meeting the patient's physical demands and spiritual and emotional needs to maintain a healthy spirit. The book emphasizes the importance of the nurse's ability to adapt to each person's specific needs and observe behavior. According to the book, nurses who regularly develop their profession are the most valuable. Nightingale was convinced that all nurses should constantly study new technologies in medicine, improve their skills, and learn all the latest developments in the field. In modern medical practice, these values continue to be relevant, as the focus on the constant improvement of knowledge is highly valued even today. The role and value of a nurse must be to protect her patients from possible threats. Nightingale encouraged nurses to defend the rights and freedoms of patients, even if the employee had to go against the opinion of the chief physicians or administrators. As nurses become the primary caregivers today, this role is becoming increasingly relevant. Employees are given the opportunity to fully meet people's needs and provide them with full-fledged high-quality care. Another essential component of nursing is collaboration and teamwork in the health system. According to Nightingale, nurses should cooperate closely with the rest of the staff to ensure that the care is of high quality and that each patient can get better results. As the modern healthcare system becomes more integrated, cooperation only increases in popularity. Finally, she believes kindness and compassion are the key to quality care. Patients need both physical and moral consideration, which is acknowledged in the book. Every patient deserves respect for themselves and their problems, so a good nurse always understands other people's fears and feelings. Practical application. Concerning the specific application of Nightingale's values and beliefs in my practice, it is essential to note that hygiene is still important in modernity. This was particularly evident during the coronavirus pandemic when I had to pay special attention to hygiene and prevention. The same applies to social distancing, hand washing, and personal protective equipment. Professional development and the ability to adapt to modern realities help specialists always be aware of current events and respond correctly to life challenges. Adapting care to a patient's physical and emotional needs is common in my medical practice. Nurses working with me successfully develop a relationship of trust with patients and their families, can patiently listen to problems, propose solutions, and create emotional comfort when dealing with people. In addition, we constantly advocate for the needs of our patients and engage in all kinds of negotiations to provide a person with better care. Conclusion. In conclusion, it is essential to note that the values and beliefs that Florence Nightingale included in her book Notes on Nursing, What It Is and What It Is Not will forever be relevant. In modern nursing practice, these principles are still essential in determining the quality of care for patients. Nightingale emphasizes the importance of health and personal protection, continuing professional development, and collaboration with other health professionals. In addition, emphasis is placed on the patient's moral support and ability to defend their right to receive quality treatment. As the foundations of modern nursing practices, These values can prevent the spread of infections and significantly improve the level of care for patients in various manifestations. Florence Nightingale's legacy inspires nurses to comply with all basic norms and reminds them of their crucial role in improving patients' quality of life.